continue buying the raffle tickets. We have...
Everybody for being here. These AMREF days are always fantastic. For joining us this evening. Karibuni sana.
Ladies and gentlemen, good evening. Good evening.
An Upper Hill branch for 2 per... 11, 12,000, 12, 13,000. Ooh, I'm getting excited. 13,000, 13,000, 14.
Mimi kwa shida ile nimepitia, nimekaa for 20 years. Nilikuwa nauliza wakati alikuja Narok tukapata matibabu, amekuwa wapi? Lakini wakati wa Mungu ndio imefika. Mimi nimefurahi sana. Na sasa hivi nikisimama, mimi nimekuwa nikitafuta wamama ambao wamekuwa wakiteseka kama mimi. Ninatembea miguu kwenda kutafuta na kueleza ya kwamba kuna uponyaji tena. Na kuna kurudi kuwa mrembo jinsi ulivyosaliwa. Mimi nilikuwa nimekaa. Hii ni jambo la aibu. Sikukuwa naweza kwenda sherehe. Sikukuwa naweza kwenda kukaa na wamama wenzangu. Nilikuwa nimejitenga kwa sababu ya yale nimeishi nikipitia. Hata nikienda mahali kama hapa, siwezi nikakula kwa sababu ninaweza kuwa ninajikojolea ama ninaenda choo bila kujua, lakini saa hizi mama, takuhug nikipita. Na mimi nilikuwa ninasema, hakika wa mama, tumepata uponyaji. Mimi nilikuwa ninauliza wenzangu, mimi ni wakati tulitibiwa, tulitoa kikundi. Tukasema kwa sababu hatukukuwa tunajuana na sasa tumetibika. Tutoe kikundi kwa sababu tumekaa miaka yote tukiwa tumejitenga. Ndio hata sisi tuone kama tutakuta wale ambao wamekuwa mbele yetu. Kwa jamii zetu unaona hata ukikaa na watoto ni shida, kukaa na mzee wako, mzee anaenda mpaka anakuacha. Na utamlaumu kwa sababu sio kupenda kwako, ni jinsi ya vile umekuwa. Lakini ninashukuru Mungu kwa sababu sasa nikisimama nimetembea all the way from Narok mpaka hapa na ninasikia ni more than normal. Nimefurahi sana. Namwambia tu Mungu amsaidie mama taifa. Nilikuwa ninasema kama ni mimi Baba Uhuru akienda nyumbani aingie yeye hapo. Kwa sababu umbali ametutoa. In fact, inaonekana anapenda wamama. Na hata tukua huko mashinani Narok, tunakutambua vizuri sana.
As you may know, fistula is a debilitating condition. But today, because of you, there is hope for women affected by the problem across the country, Kenya. And I would like to thank Ruth before she comes, even before she speaks, for her courage to let us into her life. Ruth represents thousands of women whose lives have been transformed through AMREF's Fistula program. And from today, it's not a program, it's a challenge to give back dignity to women and I want us to sustain this challenge for as long as it will take us to have 0 women having fistula in Kenya. Thank you for your financial support. Thank you for coming to play golf with us today. Thank you for your partnership with AMREF and with the women that are going to benefit from this. And above all, I must say to each one of you, thank you for believing in yourself. That within you, you have the power to transform lives, to transform a life. Because you do. And working together with you, we have the power to transform our world. That's what we are doing tonight.
For me, fistula is a human rights issue. And if you look at the statistics, 2,400 women in Kenya have this condition every year. Therefore, it's not something that we can wish away. AMREF Health in Africa is guided by the belief that women and girls are the key to transforming nations. And for this reason, we have made deliberate efforts to develop health programs that specifically address their needs. And listening to Ruth, you almost get goosebumps. And you say, if that is what, Your Excellency, you've done, I think it is something bigger than just this evening. It's bigger than a purpose and a cause. AMREF has reached over 350 women with fistula surgery and trained 451 doctors and nurses to address the issue across the country.
Fistula has denied and continues to deny our women, our sisters, our daughters, our girls, social, economic, but even political empowerment. In a modern day, one would liken fistula with leprosy of them days, where nobody had any use to get close to you, where you're an outcast, where our hope is lost and a future is robbed from you. But because of the efforts that Her Excellency, the First Lady, has put in bringing this particular condition to our very eyes, but giving hope to the victims and women and girls who have been affected, I am very pleased to recognize that it is possible to look into the future with greater hope and look into the past with great appreciation for the effort that you have brought and the hope that you have brought to our girls and mothers, Your Excellency. As a mother, we are forever grateful for this initiative, but also for the broad Beyond Zero initiative that today every woman, every girl is able to relate with, east, west, north, south of this country. On behalf of my ministry, I do appreciate the partnership and commit that will continue to partner with you in bringing hope, bringing services and healthcare to our women, girls, and mothers. We have, in recognition of the efforts that you continue to make, brought in fistula as one of our health indicators that we are indeed now able to monitor and account for through our data management systems, because one day, in the very near future, we want to look back and say we are at point zero.
The health and wellness of families is important and critical to the development of our country. This is why the government has invested towards ensuring universal health coverage so that all Kenyans can access affordable, quality health care. Wellness and leading healthy lives is an important contribution to support the government's aspiration for a healthy nation. It is also a sure way of protecting ourselves against the emerging upsurge of diseases such as cancer, heart disease, diabetes, and other non-communicable diseases. I, therefore, commend all of you for participating in this tournament, and I urge you to continue keeping active. I work towards wellness by running. Well, these days it's more like walking. And I invite you to join me in the next Beyond Zero Half Marathon on Sunday, the 8th of March, 2020. Here in this room, we have known men, women, families, and friends who, due to lack of proper health care, lack of financing or access, have suffered. Women and children are the most vulnerable, especially those living in marginalized or hard-to-reach parts of our country. Maternal health is an area that remains close to my heart, to ensure that mothers get access to antenatal care and skilled deliveries so that their lives are not put at risk. Unfortunately, despite the great strides we have made, more than 600,000 women in rural areas across the country give birth at home. This not only puts their lives at risk, but also those of their newborn babies. Maternal morbidity is one of the major causes of a mother who lacks access to proper care during delivery. Another is obstetric fistula. Both are preventable, but they are still a big problem in Kenya. The two conditions are devastating consequences of neglected childbirth experiences. They are also a stark example of health inequity in the world. These conditions continue to afflict the most impoverished women and girls, mainly those in rural and remote areas. This is why I have committed my support to provide screening and surgical repairs for women with reproductive health issues. Together with AMREF, we support their full recovery and reintegration into their communities. So far, we have impacted over 350 women through the Beyond Zero medical safaris. This is an outreach event that offers free integrated medical services. Since 2018, we have impacted communities in Narok, West Pokot, Kisumu, Nyandarua, and surrounding counties. This noble fundraising event is another demonstration of the importance of partnerships and commitments to a cause. It will support AMREF in raising funds so that many more women suffering from obstetric fistula may receive treatment and surgical repairs.